I've really enjoyed the Made by Mortals examples and walking in other people's shoes and hearing and imagining what it's like. It really helps put you in focus for putting yourself in somebody else's shoes, which is really at the heart of a lot of what we're talking about today. So I've really enjoyed that part of it so far.
Well, it's just an amazing experience. It's the first time I'm here, and I'm super excited about how we can embed research into our community outreach programs, because in the end, reaching the communities where they are is important for research. And involving them is a good thing, because so far research has been some kind of brought in from the outside, like it was said earlier, parachuted in. And I really like the change and attitude and this paradigm shift that research comes from the inside out. And I'm very excited about this development so far, and I'm really looking forward to the discussion later on.
My name's Juliet, and I'm from North Manchester. I'm involved in the community work that takes place between Cheetham Hill and Crumsall area. I've been invited today, and I'm glad that I came. At first I just thought, what was this all going to be all about? Because I didn't really read too much into the information. But I think the key point for me here, it really is around research and what researchers intend to do to make a change, to make a difference. And so that's where I'm really interested to see what's going to come out of this around that area. I think too often community groups, individuals have been used in research and they get nothing back. So I think it's, from what I can see on the pillars, and I'm going to look at it a little bit more, it's going to be quite interesting and exciting to see the work that comes out of that.
Accessible for everybody and understandable, yeah, so sort of tailored, yeah. Because do they say, is it like there's over 200 languages?
Yeah, not only to the organisations that these researchers are going to be collaborating with based on their level of understanding of research, but also it's
actually make sure you're actually doing it for the benefit of the community. So people make assumptions about what's important at the moment in time. So I'll shut up now.
It's slightly different. We may end up having that and they don't help. Because to me, where people are operating from organization or the general country legal framework with the laws and what.
And I work for an organisation called Awakening Minds. We're based in Rochdale, and we deal with mental health in the Asian community, South Asian community. I came here today. I wasn't really expecting what I got, let's just put it that way. It has been informative, it's been good, it's been a learning experience, and I've thoroughly enjoyed myself. I've enjoyed giving my opinion, I've enjoyed being listened to, and overall I've just enjoyed it all.
My name's Simon, I'm from Manchester Cancer Research Centre. We're here today listening about the new pillars that have been implemented across Greater Manchester. Very interested to see the work of that and all the community organisations here. Yeah.
It's been a really good day so far, very interesting and really useful to think how we can take forward this agenda and embed it in our work. So thanks for having me.
Thank you so much. Today is to me, is a very exciting day that we have come to appreciate and get to interact with the people from the communities and interact with the actual researchers from the VCCS sector and within the academia. It is important for us to come and have such forums and benefit from getting to understand each other beyond just meeting at points of collecting data and things like that. And when we get to a point where we are putting together policies that are going to guide us, this particular point is important for us as people who come to this, and especially when it comes to understanding the people who always respond to these studies, what they go through, and understanding the researchers, what do they go through, pressures from funders and issues of timelines, they also need to be understood in that way. So it is beneficial for us to be in such a forum today that we get this. Thank you so much. I'm John Alex Muita. I'm a public community involvement and engagement member within the NIHR. Thank you.